Interesting question. I'm going to answer a little bit biased because I'm in my own therapy, but also a mental health professional as well. While traditional CBT is the gold standard treatment for a lot of MH conditions these days, I find ACT acceptance and commitment therapy, as well as other ABBTs, acceptance-based behavioral therapies, to be quite beneficial. Why? Because the mindfulness and values-driven action has shown to hold the outcome gains a bit longer than CBT. The first 12 sessions of ACT focus on learning mindfulness, learning to be in the present moment. With that, learning cognitive delusion also takes places, learning to separate ourselves from our thoughts and just learning to watch them as they come and not judge them. Toward the end of ACT, a values-driven approach is taken where the clinician will help the client see if the behaviors they partake in to experientially avoid their feelings aligns with the values that they hold in life. The more we structure our lives by the values we hold, the less we'll let our behaviors take control and prevent us living up to those values we hold dearly. I'm by no means an expert on ACT, and this is an approach I'd love to fully practice in the future. However, I have done a bit of research on it for a few classes. In my instance, I looked into ACT versus CBT for treating social anxiety disorder. Many pieces of the literature showed that ACT was on par with CBT, and even held the outcome gains a bit longer than CBT in some instances due to the values-driven approach that helps keep the client on the right path after treatment ends. Hope this helps. There are so many approaches and modalities out there, this is just one. Over time, a combination of the two has yielded great results as well. In mental health, we pick pieces of different modalities and implement them throughout treatment.